Welcome to Better Sex, where you get the information and inspiration to create and enjoy your best possible sex life. Join your host, sex therapist Jessa Zimmerman, as she brings you expert guests, helpful tips, knowledge, and strategies to improve your intimate relationships. And now, your host, Jessa Zimmerman.
Hey, welcome back to another episode of the Better Sex Podcast. This is Jessa, and I am so glad you are here. And this is an episode I have wanted to do from the very beginning and just didn't quite find the right conversation until recently. But Kayla Potts from Planned Parenthood is joining me to talk about STIs, safer sex. What are the STIs that we need to be thinking about? What are testing protocols? How do we get tested and how often? How do we prevent that? And what are some of the myths that people still have about them? It's a great conversation. It's a little bit long, but boy, we fly through a ton of great information. I hope you enjoy the show. And before we start the show today, it is sponsored by Intimacy with Ease. It's a method to help otherwise happy couples achieve a sex life that is easy and fun for both of them, so that you can actually just enjoy your sex life with zero stress. For more information, if you want to watch a brief little training video that's available, all of that, go to intimacywithease.com. So Kayla, thank you so much for being on the show.
Thanks for having me.
Yeah, this is a topic I have wanted to cover from the very beginning of the podcast 2.5 years ago. It took me this long to find you. So let's start with just, I guess, the idea of the most common questions you get about STIs. You know, where do people start with this?
As I'm sure folks listening know, there's a lot out there about STIs and what they are and what it means and how to contract them and how to prevent them and all the things. Really, when it comes down to it, folks just want to know, what do I need to do to protect myself?
Mm-hmm.
How can I talk about this? And then what are some of those myths that are just not true? And what can I do to help stop the spread of those myths? So despite there being lots and lots of stigma about STIs, people really just want to know the basics. They want to know, just like they want to know how to prevent the flu or how to keep themselves safe, especially right now during a pandemic. We're talking a lot about public health. So STIs are in the public health realm and people want to know about them. They're just afraid to ask because there is so much around it.
Yeah. So I'm going to date myself a little bit here. I believe that when I was young, it was called VD. Which,
Oh, yes.
Maybe you don't even know. I don't know, because looking at you on the camera, you're much younger than I am. And then it was STDs for a long time. Now it's STIs. What's the rationale behind the language we're using?
Great question. So the rationale, STD is sexually transmitted disease and STI is sexually transmitted infection. Typically, when we're talking about diseases, we're usually referring to things that have clear symptoms. So folks are symptomatic. They can identify things that are happening in their body, and we attach that with disease. With STI, sexually transmitted infection, it feels a little less like a stigma. There's not as much stigma attached to the word infection as there is disease. And then, as I will talk about a little bit later, so not all STIs carry symptoms. So folks might feel perfectly healthy when they go to get tested and find out they have an STI. So since we attach sort of in society disease with symptom, it felt important to differentiate STIs from that because it helps educate that not all STIs carry symptoms with them.
It seems especially timely as we're in the middle of the whole, we're recording in the middle of the COVID quarantine, and how important it is to understand you can have an infection with no symptoms. Like it seems to me it might get people testing or thinking about this, feeling perfectly well instead of waiting till they are showing symptoms of something.
Exactly. Yeah. One of the things I'm always saying to students when I'm in a classroom is a person cannot tell if they themselves or another person has an STI just by looking at them. There's not always going to be symptoms. In fact, there's probably not more often than not going to be symptoms. So getting tested, one of my big things that I'm always saying is getting tested is the only way to know for sure if someone has an STI, yourself included, your partner, your partners. Even if someone says they feel fine or they're not worried about exposure, because STIs don't carry symptoms all the time, we just can't know unless we get tested.
Okay, so that I'm going to take just a teeny little veer from where I thought I was going. Could you talk just a little bit? Because again, when I grew up, people did not routinely go get an STI battery of tests. And now I know, like my children do, so it's it's a thing. Yeah. So what are the recommendations about testing? What you should get tested for, how often, when, like what are the sort of best practices around that?
Great question. So something that happens sometimes is we as humans assume that we're getting certain tests done, say when we go to our yearly checkup. So what I can recommend to folks is don't assume that you're getting tested for STIs. They are routine in my world, in the sexual health world, but they're not necessarily routine for primary care providers. So if you are someone who wants to get tested, let your provider know that. Let the office know when you're scheduling your appointment. That way, you know for sure that you're getting tested and they know to prepare the things that they need to prepare. As far as what to get tested for, most folks will be recommended by their provider to get tested for the common STIs like chlamydia and gonorrhea. Some of the other STIs like HIV and herpes, you would think that they would be commonly tested for, but that's not always true. So what I would recommend for a person who wants to, say, get a full panel test is don't say full panel when you go in. Say, these are the lists. This is a list of STIs that I want to be tested for. The provider might ask questions about sexual history and risk factors. They might make some recommendations to get tested for certain things or not certain things. As the patient, you always have the power to say, thank you for your opinion. I would still be tested for these STIs. Providers are trained, of course, to try to be most efficient with the amount of time that they have. So they might say, oh, based on your sexual history, I'm not worried about that STI for you. That's well-meaning. You still get to say, I would love to still get tested for that.
Okay. Do most people get tested through their own GP or I mean, I'm sure Planned Parenthood must do this or other places that are more specialized?
We certainly do at Planned Parenthood offer STI testing for folks of all bodies. But yes, a person can get tested at their primary care physician. If a person's under 18 and they are still seeing a pediatrician, they can get tested through them. So wherever a person is getting their health care, they're likely going to be able to get their STI testing as well. Folks can choose to go to a more specialized provider, but it's the same test. It's really just their comfort if they prefer to go to their primary care or specialized care.
Okay. And what are best practices in terms of when to test, how often to test?
Yeah.
General ideas, or at least your thoughts on that,
Yeah. So generally speaking, if someone is sexually active with one partner, then the recommendation is once a year. If they are sexually active with multiple partners, then the recommendation is every 3 to 6 months. And that can increase if someone is concerned, maybe a partner or a partner of a partner contracted an STI, or maybe they have concerns that they were exposed, right? Folks can get tested as often as possible, but generally speaking, every 3 to 6 months if they're sexually active with multiple partners, and then once a year with one partner. And then if possible, before and after each partner is great. That's a lot of testing, we know, but it's great to just know your status when you enter a relationship. I'm going to talk a little bit later about communication and consent and disclosure. So it's good to know your status always, even if you're not necessarily being sexually active at the time. Always good to know that before and after a partner, if possible.
Okay. And are all of these different tests really on the spot on the moment, or could you test negative one? You're between relationships. You're not having sex with anybody new. You test negative on everything. Is there anything that would show up positive a week later, and we just didn't catch it based on the time of the test?
It's more for the viruses, like say HIV. Yes, it's possible that if someone tests too soon, the test is not going to pick up. positive yet. So that is part of the recommendation for every 3 to 6 months, is that window of about 3 months for things like HIV, that gives it time to show up. So if someone, say, ends a relationship and they want to get tested, they might wait a week or two. The vast majority of STIs are going to show up within a couple of weeks. And then there are a few that they'll want to wait a little longer for. And those are all nitty-gritty details that someone can know if they want to. They can also just say, this is what I want to get tested for, and their provider can help them think about a timeline, especially if they go to a specialized place like a sexual or reproductive health center.
Okay. So what are, I guess, I don't know if I need a comprehensive list of STIs, but like, what are the main ones? And then I'm wondering which ones are of more concern than others, and why maybe.
So first, I just want to talk a little about what we mean when we say STI. So sexually transmitted infections, most commonly they're classified that way because they're usually sexually transmitted. So, or they can be sexually transmitted. What exactly sexually transmitted means, I'll talk about in just a bit.
Okay.
But that includes a general list, things like chlamydia, gonorrhea, syphilis. Those are bacteria STIs. We also got the viruses that most folks know about, which are things like HIV, herpes simplex virus, HSV 1 and 2, human papillomavirus or HPV, and things like hepatitis. And then there are parasite STIs, which are things like trichomoniasis, crabs, and scabies. So those are the common STIs.
Okay.
If someone wanted to get tested, say that full panel, I offer in quotations because I hesitate using that language. It means different things to different providers, but typically chlamydia, gonorrhea, syphilis, HIV, and herpes are the things that folks are going to get tested for if they want comprehensive testing.
Okay.
If they're concerned about a specific exposure, they should mention that.
Right. So HPV is not considered one of the typical ones people would test for.
It is the most common STI. So providers are going to push testing for that, maybe more likely than they're going to push testing for other things, just because it is so common. So when we talk about statistics, HPV, human papillomavirus, is the most common STI in the United States, but chlamydia is the most common reported STI. The difference between those two things is chlamydia is reportable. So when someone goes and gets tested and they test positive for chlamydia, the state gets that information. So it gets reported to the state. We have this many new cases. Here are the demographics. HPV is not a reportable STI. So the CDC collects statistics on it, but it is not reported to the state in the same way that, say, chlamydia and gonorrhea are. So that's the difference. That's the reason for that difference. But it is the most common STI because it is most commonly asymptomatic. So folks can be what we call a silent carrier of HPV, where they just have no symptoms and they can pass it to partners. HPV, of course, has many different strains, but the ones that most folks know about are the one that causes genital warts or the one that causes cervical cancer. So because there is a vaccine for HPV, it's probably going to be part of the conversation, say at a pediatrician, and definitely at a well person visit. The provider will likely ask if a person has gotten the HPV vaccine. So that tends to be part of the general well-being visit because it is so common, whereas other STIs, unless someone's concerned about it, they don't come up as much.
Right. Okay, and should we be more worried about some of those than others? Are they equally treatable, equally risky?
Good questions. So I would say I hesitate to use the word worried. But I would say we, as people who are maybe sexually active, they should know about these STIs and they should know about how to get tested. Chlamydia and gonorrhea are very easy to transmit. That's part of why they are the highest reported STI. Of course, we might have heard in the news all of these scary headlines about antibiotic resistant gonorrhea and such.
Oh, yeah, right.
So what I'll say is the rates of transmission have increased over the last few years, certainly. And maybe when we're talking about stigma and communication, we can speculate as to why, but if a person is using protection, getting tested, communicating with their partner, then they don't need to be worried. I would say they just need to be aware.
Okay.
Aware is the word that I will gently replace worried with.
I like that. Okay.
Yeah, so the bacterial STIs like chlamydia and gonorrhea, they're certainly more common. So that leads folks to think that they need to worry about them more. It just means that they're asymptomatic. Often folks might not know that they have it. And then they're accidentally transmitting it to partners because they are not showing symptoms and therefore not worried. And then some of these other ones, these other viral STIs or parasite STIs, they might not be as common, but again, still things that folks should be aware of. If anyone listening is really into statistics and they dig into those numbers, the CDC, Centers for Disease Control, has a whole bunch on that. If they want to know, what is the prevalence and what sort of communities are highly impacted. If someone wants to know maybe more specifics about each STI, I'll send them to PlannedParenthood.org. They can dig deep into the symptoms and what the specifics of it are, but generally, all people who are sexually active should be aware of the STIs that exist and what their risk is for them. And really, that's going to be highly personalized because depending on what type of sexual activity they're doing, that's going to change their risk factor. So maybe what we should move into next is talking about how STIs are transmitted.
Yes.
I think that's going to help folks find themselves in this conversation.
Yeah, because it sounds like they're not all transmitted the same way. Like certain activities are going to be riskier for some than others. Okay.
Yes. Yeah. So when we talk about STI transmission, STIs are most commonly transmitted sexually, but there are some ways that a person can contract an STI that don't have to do with sexual activity. So I'll touch on that in just a little bit, but there are two main ways that STIs are transmitted: through bodily fluids and through skin-to-skin contact.
Okay.
So when we talk about bodily fluids, we're talking about 6 very specific bodily fluids. Those are vaginal fluid, pre-ejaculatory fluid, also known as pre-cum, semen, blood, and in the case of HIV, breast milk. So those are what we're talking about when we say fluids.
Saliva, is that one of them?
It is not, and that is a really common guess, especially when we're in a classroom. There are some STIs like herpes, which we'll have to dig into a little deeper, where there's an exception to that, right? Because that transmits a little differently, but generally, no, saliva is not at risk for transmitting STIs.
Okay.
Really, these 6 fluids. Saliva can transmit other infections, certainly, but STIs are not a huge risk for saliva.
Okay.
And then skin-to-skin contacts, of course, I don't just mean any skin on any skin. We're talking about sexually transmitted diseases here, or infections here. So what we're referencing when we say skin-to-skin contact is what we call mucous membranes. So those are things like the mouth, the anus, the vagina, the tip of the penis. Those are susceptible areas of the body. The skin on those parts of the body is thinner. It is more susceptible to infection. And that's just true across the board in terms of infection, and especially for STIs. So if someone's sexual activity involves a mouth-to-genital contact or genital-to-genital contact without the use of protection, then they are at risk for STIs. If their sexual activity involves any of the fluids that I named, then they are at risk for STIs. So when I'm in a classroom, what folks are asking all the time is what specific sexual activity transmits STIs. And the better answer to that is it is not really about what we call the sexual activity. It's about what is involved. So a person of any body, of any gender identity, of any sexual orientation, if their sexual or intimate behaviors involve these fluids or involve skin-to-skin contact with these susceptible parts of the body, then they are at risk for STIs, and they are the folks that need to be aware and getting tested and having conversations about them.
Right. And I'm sorry, did you say your mouth is also one of these mucous membrane places? Okay.
Yeah.
And then is it certain diseases or certain infections transmit through fluids and certain through membranes, or is it that they do both, and if you put these things together, you're getting twice the exposure?
Great question. Yeah, so some of them are more commonly transmitted through bodily fluids, and some are more commonly transmitted through skin-to-skin contact. But really, generally, if someone's sexual activity involves skin-to-skin contact without protection, then it's probably also automatically going to involve those bodily fluids.
Right.
So that distinction, I wouldn't encourage folks to make it. It's more like if you're concerned about it at all, if you think that you might be engaging in sexual or intimate activity that involves these things, then STIs are for you to think about. And the mouth comes up a lot because not all people include kissing or mouth-to-mouth contact as a sexual behavior. That's why I say things like sexual or intimate behavior, because some folks might not think of kissing as a sexual behavior, but it can transmit certain STIs, most commonly herpes, which is what folks are generally concerned about.
Right.
So let's talk a little more on that specifically, because it tends to come up a lot. So herpes is the herpes simplex virus. There is HSV1, which is oral herpes that typically or does show up as cold sores, so sores on the mouth or around the mouth. And then there is HSV2, genital herpes. The same types of sores show up, but they're on the genital region.
Is it the same virus?
There are two different viruses, but they can show up on either part of the body. So since we're on a podcast, this visual is not helpful, but
you can describe what you're doing with your hands. Yeah.
Yes, my hands are not helpful. So typically, if you think of drawing two stick figures on the board, if there's oral mouth-to-mouth contact, you can transmit the HSV virus. If there's mouth-to-genital contact, genital-to-genital contact. So there are two different strains of the virus that typically show up on the mouth or genitals, but that the HSV
they can
virus
mix and match.
They can mix and match, certainly, yes. Someone has a cold sore and they have unprotected contact with someone's genitals, that person could develop genital sores, even though they might test positive for HSV1, because the site of contact was their genitals. That's where the sores will show up, and all different sorts of variations. So HSV is very contagious when sores are present. So if someone has a cold sore or sores on their genital, the best thing that they can do is avoid contacts with other people, and certainly sharing things like drinking glasses or chapstick or makeup, etc. If someone does still want to engage in sexual activity during an outbreak, there are barrier methods that they can use, and I will talk at length about those. But generally, avoiding contact is step one. And then if contact is not avoided, to definitely use a barrier method to keep that skin-to-skin contact from happening and to keep those fluids from exchanging. And I will say, I don't generally share specific statistics about STIs because it tends to lean folks towards like a fear-based approach. But HSV1 oral herpes is very, very common.
Yeah.
A lot of people contract it when they are younger, say when they are children. Because it is so common, it might happen from kissing a relative. It might happen from sharing drinkware or chapstick or whatever with a friend. So a lot of people have the HSV1 virus in their body, whether or not they have shown active cold sore symptoms. So one of the things that's true about herpes is, along with all of the STIs, is there's a lot of stigma. There's a lot of jokes or punchlines or one-liners about herpes or about being careful about sharing things. So despite it being a really, really common STI that folks have, it is still being talked about as this stigmatized, gross thing that makes someone dirty, when we know that that's just not true. A lot of folks have it. The majority of the globe has HSV1 virus in their body, and they might just not know that it is an STI when they show symptoms, and they might kiss another person or share things and just not know. So the best thing that we can do to prevent that is to have conversations like this. Herpes is common. Lots of folks have it, both HSV1 and HSV2. And as long as we are having conversations and using protection and trying to avoid contact when there is a cold sore present, then there's nothing to be afraid of with it. It's just part of our world.
Yeah. Should we launch into protection and how it is we prevent these infections?
Okay. under the umbrella of protection, there's lots of things. So most obviously, if someone's going to be sexually active, using barrier methods cannot be recommended enough. When I say barrier methods, I'm talking about condoms. I'm also talking about dental dams. So you'll hear Planned Parenthood educators say things like internal condom, which is also known as the female condom, or external condom, also known as the male condom. The reason we use that language is to be inclusive of gender identity, and also because barrier methods can be used on things like sex toys. So if someone is sexual activity involves sex toys, it is probably also going to involve some of those fluids that we talked about. And
Right.
if that toy is being shared, then it can absolutely transmit that STI. So using things like external condoms on toys is a great idea for protecting against STIs. And then, of course, using condoms on bodies as well. The external condom, as the name implies, goes on the body. The internal condom or female condom goes inside of the vagina or rectum. People should not use both. So they should not use both an internal and an external condom.
So we don't just double up and be extra
safe? We do not, yes.
No.
I completely understand the line of thought. It makes sense just to double up, but condoms are incredibly effective if they're used consistently and correctly. Consistently meaning every single time someone engages in sexual activity, correctly meaning all of the steps are followed. The steps are going to be on that little booklet that comes with the barrier method. If someone, say, just has a condom and doesn't have that little booklet, a quick Google search will tell you the steps. There's 10 to 12 of them for using an external condom. And it's important to follow all of those steps because they're there for a reason. Things like making sure the condom is the right size. It should fit snugly. It shouldn't be really tight. It shouldn't be loose. They do make different sizes of condoms, but as I tell students in a classroom, the overwhelming majority of bodies are going to fit perfectly fine into what we call an average condom. If someone has a need for a smaller condom, they exist. There are bigger condoms. There is a company out there that makes condoms with 20 or so different sizes, and that they have a measurement tool that you can use. So really making sure the condom is the right size is very important. Magnum condoms or extra large condoms. If folks listening at home want to try and experiment, you can, try to put a condom over your leg or your arm. I've had teens that I work with put it over their head. I mean, they're very stretchy and resilient. So if someone maybe says something like, I'm too big for a condom, you have my permission to tell them, Kayla from Planned Parenthood said very unlikely. And if someone is too big for a condom, it's about width and not length. And that is why they make things like XL condoms, so that it's not too tight. So condom size is important. Making sure to pinch the tip so that there's room for ejaculation, so that air leaves the condom. And then, of course, only using them once. So condoms are one-time use only. Those are some of the examples of the steps that are important for folks to consider.
Right.
So those are condoms. And then condoms can be used for genital-to-genital contact. They do make flavored condoms to be used for oral sex on a penis. What I will always offer with that is flavored condoms are not for genital sex. Flavored things on condoms have sugars, and that can create infection in the vagina. So flavored condoms are strictly for oral sex on a penis. They make lots of other types of condoms, glow in the dark, ribbed, colored, all sorts of fun stuff for genital to genital contact. And then if someone wants to perform mouth to genital contact, say on the vulva, the external part of the vagina, or the anus, then they can use a dental dam. A dental dam, if folks don't know what that is, it is a thin sheet of latex, which is the same thing that most condoms are made out of. And the person would just hold that thin sheet of latex between or over the part of the body that they're making mouth to genital contact with. And that effectively prevents the fluids from exchanging, and it prevents that skin to skin contact. So that is how folks can prevent STI transmission for oral sex. I would say one of the biggest myths that I hear is that STIs can't be transmitted through oral sex. That is so false, very false.
Okay.
So using an external condom for oral sex on a penis is great. Using a dental dam for mouth to genital contact is great. And then, of course, using a condom if someone is making genital to genital contact. Those are some ways that folks can prevent STIs. If someone is, say, performing what we call digital sex, which digital does not mean cyber sex, it means hands,
right.
Fingers. So people can use things like latex gloves. If they have a latex allergy, they make gloves that are non-latex. They also make external condoms that are non-latex. So using gloves is an option. They do have little finger condoms that a person can put on that can prevent contact, especially if someone has, say, a cut.
I was going to say, is that the only reason you'd be at risk at that point? Because that's not a mucous membrane. Mm-hmm. So you're just concerned that there might be some sort of small cut or something like that.
Yes, if there's a small cut, or if someone's trying to avoid getting fluids on their body, that could be a reason for using that. If someone has a cut or an open wound anywhere on their body, they should think of that as highly susceptible skin. So that includes if there's a sore, that includes if there's a cut, and even if it's the tiniest of cuts, microscopically, it's still a risk. So yes, using things like gloves or dental dams or finger condoms is a way to prevent transmission. Because remember, blood is one of those fluids that can transmit STIs.
Are dental dams at the drugstore just like condoms?
I certainly wish they were. Part of my job is to facilitate a group of teens that teach in the schools with me. So one of the projects that we have them do at the beginning of the year is to go into their local stores and sort of assess how easy it is to get barrier methods. Spoiler alert, it's not. A lot of places make it really hard, like they'll lock it up because they're worried about theft. So then a person has to say, hello, can you please unlock the box of condoms so that I can grab them? That often leads folks to think that there's age restrictions on barrier methods, and there are not. So any person of any age can purchase a barrier method, but they might come across, some of that stigma, especially if they're maybe a young person accessing barrier methods. But so my folks locally found that it's really difficult to find dental dams in the drugstore. We do sell them at Planned Parenthood. You might be able to find them at your local provider's office. You can definitely call ahead and ask. But because it's harder to find them than to, say, find external condoms, for creating life hacks, you can take an external condom, you can cut the tip off, cut up the side, and roll it out. And that will create a smaller but still effective dental dam. If someone Googles, making a dental dam out of a glove, it will show them 3 different ways to cut a glove so that you can hold it over the body, or maybe even keep one of the fingers in so that you can use that. So the internet is a treasure trove, and it's dangerous.
Right.
So I'll offer, there's lots on the internet that's not true about STIs. But if we're doing pointed Googling, like how to make a dental dam from a glove, how to make a dental dam from a condom, those are safe, effective ways to create your own dental dam, especially because it can be tricky to find them in stores.
Hey, this is Jess. I'm just taking a quick break, and I want to make sure you know about the guide I wrote about how to talk to your partner about sexual concerns. This comes up a lot in my practice. People have struggles, and it takes them so long to bring it up with their partner. They're afraid that conversation is going to go badly, their partner's going to be upset, the partner's going to be defensive, or they just don't know how to talk about sex and sexual problems. Common problem. So I wrote this guide that really helps you address this. It helps you prepare for the conversation, how to introduce the conversation, and then tips about how to actually get through the conversation so that you can change things with your partner as a team. If you are interested in this guide, you can find it at bettersexpodcast.com/guide. Again, bettersexpodcast.com/guide. Happy to send it to you.
So I want to get to the myths in a minute, but I also just wonder, is there a hierarchy of safety in terms of sexual behaviors? Like,
Great question.
What's absolutely safe, what's, mostly safe, and what are the very riskiest or most likely to transmit an STI kinds of activities?
Yeah. So, I mean, the safest way is, of course, abstinence, not engaging in sexual activity. But I'm going to guess if folks are listening to this podcast that they're probably not practicing that.
Right.
So that is the only 100% effective way, of course, is to not engage in vaginal, oral, or anal sex. But if folks are not choosing that method, there has been a long-standing myth or idea that men who have sex with men or people with penises that engage in anal sex are at highest risk for STIs. There is some statistics to back that up, and a lot of that is steeped in actually stigma and misinformation stemming from sort of the beginnings of the HIV epidemic. So if a person, it doesn't actually have anything to do with the person's gender.
Mm-hmm.
If they're engaging in anal sex, that is typically a riskier sexual behavior than, say, oral sex, for sure.
Okay.
Vaginal sex is a little bit riskier than oral sex, but all three of them are risky in terms of they do transmit STIs. And we're really getting into the nitty-gritty of statistics here when we talk about one being more risky than the other. If people are engaging in any of them, then they're at risk. They should get tested. They should use protection. Yeah.
Okay. I would put on that list, though, like mutual masturbation, like we lie next to each other and touch ourselves would be totally safe, right? And
great. That is a
share sexual experience.
Absolutely. And that is a sexual behavior, an intimate behavior that people choose. You're not at risk for transmitting STIs. You're not at risk for pregnancy with mutual masturbation. And it can be really fun and exciting and a good example of foreplay. So fully here for that, especially as a prevention method. And then before we talk about myths, I just want to mention a couple other prevention things. So I mentioned vaccines. So there is a vaccine for HPV. There is also a vaccine for hepatitis. People typically get that as part of routine healthcare, unless they're specifically asking to not get it. If a person wants to know if they've gotten these vaccines, they can just call up their provider to see if they have. And then getting tested regularly, super great at preventing, right? If we know that we have an STI, then we are going to be able to get treated or cured or tell our partner, which is going to make it less likely that gets transmitted. And communication is a big part of prevention.
Yeah, right. But we got to talk about that too, right? How do we talk to new partners or even at long-term partners about this stuff?
Yes. I will just say some affirmations to front load. It is scary and it is difficult. Talking about things that carry stigma is hard. So I just want to affirm, if folks think about having this conversation and maybe they get a little sweaty or they start to increase their heart rate or they feel nervous, all of that is a perfectly natural response to thinking about having this conversation. What I always say when I'm presenting is I'm going to seem really comfortable. I'm going to seem really knowledgeable and like I totally have no stigma about this. That's because that's my job and this is what I talk about all day, every day. If you are not at that place, then that does not mean you're failing. It just means you don't talk about this as much. Things that we don't talk about as much are going to feel scary. So affirming the scary and also just a little bit of bravery is all a person needs in order to have this conversation. Some examples, if a person is newly engaging in a relationship with a person and they want to talk about STIs, some great ways to start that are, I've really enjoyed the time I've been spending with you. Before this goes any further, I just want to make sure we talk about safety. Here's the last time I was tested for STIs and this was my results. When was the last time you were tested? I know it can feel awkward, but it's important to me that we talk about this. And one of my favorite lines is, there's nothing sexier than getting to completely relax when you're engaging in sexual activity. And one thing that a person and people can do to get to that point is have that conversation about STIs. So they're not worried about it in the back of their mind when they're being sexually active with someone because they've already talked about it. They've already addressed it. Other things, if you are in a relationship with someone and you maybe have been engaging in sexual activity for a while, it's not too late. Don't feel like just because you haven't had this conversation that you now can't.
Right.
You absolutely can. In fact, use this podcast, use me as a catalyst. Say, I was listening to this podcast the other day.
Kayla said.
Yeah.
Yeah.
And you were talking about, STIs, and I didn't know that they were this common, and I didn't know that they could be transmitted this way. So, just to be safe, I want to make sure that we get tested so that we know our status. Oftentimes when people experience barriers to talking about STIs, it is because of that stigma, but also because of the fear of how the person will react.
Mm-hmm.
It is true that people might be shocked. They might experience some of that negative stereotype or stigma within their own body, right? So they might say things that aren't exactly nice. They might be offended if someone asks them about their STI status. One of our things that we do in society is we assign people a clean or dirty status. I would like to officially opt for us removing that from our language. STIs do not make a person dirty, and not having them certainly does not make them clean. So what I would say is make time for it, just like any other important conversation. Don't casually mention it when you have 5 minutes together. Make the space for it. Maybe when you're already at date night, you're already relaxed, you're already focused on each other. Try to do it before you engage in sexual activity if possible. It's a lot easier to have a conversation about safety and protection outside of the heat of the moment. And then, of course, prepare yourself for whatever kind of reaction they might have. I'll say you deserve respect. You deserve to communicate your status, and you deserve to be communicated to about statuses.
Yeah.
So if someone does react really horribly to being asked about STIs, I would say that's not great for a person, right? And consider that and give them some space, right? They might come back an hour later or a day later and say, oh, okay, turns out that I really wasn't prepared for that, and it shocked me, and I maybe said some things I didn't mean. If they choose not to continue a sexual relationship with you, try not to take it personally. They're choosing to protect themselves the best way that they feel, and it probably doesn't have anything to do with you as a person. I'm sure you're lovely, and I'm sure they had a great time with you, but maybe their choice is to avoid the risk completely, right? So try not to take it personally, but having that conversation, that little moment of bravery, it's going to make it better. It's going to make your sex better. It's going to make your relationship better.
Yeah.
It means that you care about each other. You are trying to keep each other safe. You are not accusing each other of being promiscuous or dirty or any of that. You are simply offering protection, and that feels sexy to me, and probably to a lot of people as well.
One of the things I've heard is that it's actually older people that have a pretty high rate of STI transmission. And the way I heard it described is we are people that are, we didn't grow up having those conversations. And so it's a conversation part of this that gets to be a barrier. And so these infections are spreading. So, like I know you're working in classrooms with young people, but the older people listening to this podcast, I think those are great phrases to use. Hey, I've been thinking about this. I'm aware of this. Let's have this conversation.
Yeah, I learned this new thing. And honestly, when I was in high school, we didn't really understand that pre-ejaculatory fluid and rectal fluid could transmit STIs. So we're constantly learning, right? So if someone is 30 or 40 or 50 or 60 and thinking, I didn't know any of this, you're not alone.
Yeah.
It changes rapidly. What we know about infection and transmission and all of it changes. And if people get sexual education, it's either going to be in 5th grade and it's going to focus on puberty. It might be in middle school or high school and it's going to focus on pregnancy prevention. And then that's it, right? If they even got that, it stops there. There is not really a way for adults, and especially older adults, to engage with this, other than maybe some Googling, which, as I've mentioned, can be daunting. So I would say if folks want to learn more, PlannedParenthood.org, some of the language that I've used around how to have this conversation, there are videos demonstrating it that folks can watch. Demonstrating how to share STI status if someone knows they're positive, demonstrating how to ask about STI status, talking about consent. So if folks are listening and they're thinking, this is sex ed I haven't gotten ever, or at least in 20 years, it exists. Just make sure it exists on a place that is fact-checked and comprehensive, and not based in fear.
Right. Yeah, and it makes me think about the whole sex ed thing. I don't know what the stats are for how many states are just using abstinence-only education. Like the only solution to this is just don't do it.
Yeah.
So then they're not learning these prevention techniques.
Exactly. Yeah. And when we talk about harm reduction, we know that that's not effective, right? Telling
Right.
people do not do this thing is not an effective way of keeping them safe, right? Because they're probably going to do the thing. And because you've told them not to do it and nothing else, then they're not going to have information about how to keep themselves safe while they're doing it.
Yeah.
And one thing that intersects with that I just want to mention briefly, I talked about STIs being transmitted non-sexually. If folks are engaging in drug use with needles, that is often a way that STIs like HIV can be transmitted through the blood. So making sure that there are clean needle exchanges and information about this out there is a great way to offer prevention in a non-sexual way. If you're getting a tattoo or you're getting your ears pierced or whatever, making sure that you get to see that a clean needle is used and that sanitation practices are followed. Those are things that you can keep an eye on. I'm not going to say worry, I'll just say aware, so that you just so you're aware, because blood can transmit STIs, there are some very specific situations where you should be aware of that. Getting a tattoo, getting a piercing, IV drug use are a few of those as well.
Right. All right, so let's hit on the most common myths about STIs that we want to debunk before we finish today.
Yeah, so since we're in June, we're recording this in June, it is Pride Month. I always want to mention that there is still in 2020 this idea that HIV only impacts folks with a penis who engage in anal sex. Not at all true. HIV can be transmitted through those fluids that I mentioned, and that exists because when HIV first was discovered, that was the group that was blamed for it. Blamed, right. Meaning society decided that because cases were popping up in this community, that it meant that they somehow created it or were responsible for it. So that's a huge myth that I would love to just set the record straight on. HIV impacts people of all bodies, of all identities, of all orientations. It impacts people who are not even sexually active, as I've just mentioned. So yeah. If I could ask one thing of folks, it would be do a little bit of educating yourself on the history of HIV and some of the oppression and just straight up discrimination that happened as a result of that. When people are afraid, they say things that are awful, and those things stick around in our public consciousness, right? Yeah. So even now when I'm engaging, not just with classrooms, but also adult groups, some of those myths about HIV still exist. We are in a wonderful time where we have PrEP and we have antivirals that are going to make it nearly impossible for HIV to be transmitted if someone's on those medications. So the science of HIV has changed dramatically in the last
Yeah, it used to be a death sentence, right? You get this thing, you will die. Yeah.
Exactly. So that sort of falls under that umbrella myth about HIV is people can now take medication if they're taking it every single day, the antiviral medication, and their partner is also taking PrEP. The risk of transmission is virtually zero. If you want more information on that, you can Google U equals U, the letter U equals U. That's the CDC's campaign. That is relatively new information in the last 5 years. So that is something that is true. So now people who have HIV can live long, healthy lives that they would have without that HIV status because of this medication. It also means that sex lives continue if folks have all STIs, but especially HIV. And that also includes an assumption that people have access to that medication. I always want to offer that that's not possible for all people.
Right.
Depending on someone's insurance status or employment status, that medication can be very expensive. There are programs that help with it, but all of that, those are hoops to jump through, right? And it can feel overwhelming. So if someone's listening and they have HIV or are in a relationship with someone who does, give Planned Parenthood a call, ask them to tell you all about PrEP and all the things that you can do to reduce the likelihood of transmission, because it's an exciting time in science. We have all of those things at our disposal, and it can feel overwhelming to learn all about it. So let someone else do the work for you, but those things exist. So that's just true. So all of the myths about HIV, I would love for us to just leave behind in 2020. Yeah. And then other myths, there is this idea that only a certain type of relationship or a certain gender of partner is responsible for STI status and tests and protection. And I'm sure that Emily will talk about this in the birth control episode as well, but all that, let's just throw that away. If a person's in a sexual or intimate relationship with a person or several people, all of those people are responsible for communication, disclosure, protection, getting tested, all those things. There is not one person that is responsible for it. This conversation comes up a lot around consent. Consent is a conversation, right? It is not a one-sided question. And it's the same for STIs. So a person does not say, here's my STI status. Okay, now let's have sex, right? They say, here's my status. What's your status? How do you want to protect yourself? What are some of the things that you want to do? So similarly to how people would engage in a conversation around consent, I would argue that the conversation around STIs is actually bundled into that conversation around consent. One of the things that needs to be true about consent is that it's informed. Just like we sign a paper when we get a tattoo, just like we sign a paper when we get a shot, we are saying, okay, I understand the risks and I sign up for it, right? So with sex, part of what needs to be informed about is risk. So that includes talking about sexual history, that includes talking about your most recent STI panel and what the results were. That way, a person or people in that sexual encounter can decide, oh, based on what you just told me, here are the protection methods I want to use, or here are the behaviors that I want to limit us to, or actually, never mind, I don't want to engage in this sexual encounter with you. But none of that can be assessed if the conversation doesn't happen.
Right. Any other myths come to mind?
Okay, I'll address the age-old ones about getting HIV from a toilet seat. Not going to happen. It seems silly, but they still exist because they still make the rounds. So you can get some communicable diseases from a toilet seat. That is why those lovely paper covers exist. But STIs do not live on surfaces like that. So when HIV was first discovered and people were first learning about it, there was a whole range of things like, can you hug someone? Can you kiss someone? Can you be in the same room? Can you breathe the same air? So what I will say across the board for STIs, they are not airborne. They are not going to live on surfaces like counters or dishware or toilet seats. You are not going to transmit an STI by hugging a person, and you're not going to transmit things like HIV or chlamydia or anything like that by kissing a person. So really just focusing on those fluids, focusing on those skin-to-skin contact points, right? Those are your risk factors. If you've heard this idea about an STI be transmitted some other way, it's more than likely a myth. You're not at risk. It's not just out in the world. And then I'll end on this myth that STIs do not spontaneously create themselves. So if a person does not have an STI, then they're not going to be able to transmit it to someone else. So this often comes up in conversation because someone will say, well, I haven't been sexually active for a year. How could I possibly have chlamydia? It must have just happened, right? It didn't just happen. You probably have had it in your body this whole time, but because it was asymptomatic, you didn't know. So that comes up, or folks will be accused of things like infidelity if they test positive. So just be aware of that timing. That person could have had that STI in their body for a long time. Maybe their test was negative because they took it too soon. So just be aware that you cannot just get an STI, especially if you've both been tested, or all of you and all of your partners have been tested and you're negative. STIs are not going to create themselves in that environment. They have to come from a person who has the STI in their body.
Right.
And if it's something like chlamydia and gonorrhea, and they've been treated, they've taken all the antibiotics, it's not going to be in their body unless they contract it again. So one of the things that we can do to kind of help reduce the stigma and reduce the transmission rates of STIs is to just really have frank conversations about what's science and what's fluff, and how can we really, really respect each other by focusing on the science and then letting go of all of this fluff stuff that's not true.
Right. So where can people find you, or where should they go for Planned Parenthood? I think you said it was just plannedparenthood.org, but let's make sure people have the website.
It's real easy. It's just plannedparenthood.org, and you can find access to local education services through that website. So if you want a Planned Parenthood educator to come talk to you or your group, or you want to learn more about Teen Council, which is that peer education group, plannedparenthood.org. Put in your zip code, it'll give you location-specific information. That's also where you can get videos on everything from STIs to birth control to consent to PrEP to PEP, all the things that are in the realm of sexual health you can learn about on that website. And that's where I would recommend folks, if they're wanting to get in contact with an educator. I'm based here in Washington State, but if they're somewhere else, there are thousands of Planned Parenthood educators that are ready and willing to engage with you and are in your community. So I would reach out to those folks, but you can start at plannedparenthood.org, and that will give you sort of a landing page for all the things.
Great. Thank you so much. I feel like we covered a lot, so I appreciate it.
I did, yes. If there's anything else that comes up, I'm around. And again, that website's a great resource. And then I welcome, if folks have questions that they end up asking you after this, call me back in. I'm happy to answer them, but I'm confident they'll find those resources online as well.
Great. Thank you.
Yeah, thank you.
You've been listening to Better Sex. Please visit our website, bettersexpodcast.com, for show notes and additional episodes.
And that's a wrap for today. I really hope you enjoyed the episode. If you are enjoying the podcast, if some of this material resonates with you and you would like to make a difference and make sure that this keeps coming out in the world once a week, ongoing, there are a couple things you could do to show your appreciation. The first would be to go to iTunes and rate and review the show. That really helps us be found by new listeners when you review the show on iTunes. You can find a link at bettersexpodcast.com/iTunes. The other thing I want to invite you to consider is becoming a Patreon. For a small monthly pledge, you get some benefits. So for $2 a month, you get advance access to every single episode. For $5 a month, you get a chapter of my upcoming new book. And for $10 a month, I host quarterly get-to-know-you and question-and-answer chats over the web, and you get invited to that. I would love to have your membership in that, become part of the Better Sex family. You can find a link at bettersexpodcast.com/Patreon, which is Patreon. Again, thanks for listening. I'm glad you're here. Feel free to comment, ask questions, get in touch. I'd love to hear from listeners. Thanks.